Hi, my name is Jody. I work here at Ballarat Health Services for the Centre for Safety and Innovation. My job is the Clinical Risk Coordinator, and today we'll be talking about incident reporting through VHIMS. So when we talk about incident reporting, we talk about reporting adverse events, and by adverse events what we mean is any incident, any event that has the potential to cause harm to patients, clients, staff, contractors, any of those sort of people that are involved in our world here at VHS. So we'll work through the system and go through it step by step. So Riskman is located in the Common Apps and Reporting section here, as located on the screen, and it's down here under Riskman, VHIMS, Hazard Reporting and Incident Reporting. It's also located over here as well. So there's two options to get to where you need to get to, but this is the one that I mainly use. Once you click on there, you'll be brought up to this screen here. So if you've already got an existing username, you can actually log in over here using your existing login. However, for first-time users, what you'll need to do is click here to create new login. Often we find staff will go to other staff and say, I don't actually have a username, so I can't complete a VHIMS. That's not in fact the case. What you can actually do is encourage them to create their own new user login. If by any chance they've forgotten their username, what they can actually do is click on forgotten password, like we would do with any system that we forget our password, and it will send an automatic response back to you via email to confirm your password details. As I said, if you've got your details, what you do is click onto your username and enter that in, and your password. Unlike our other systems here at VHS, we don't ask you to change your password. It never expires, so it will always remain the same. You can change that if you wish to do so by going into My Workspace, My Details, and you'll see all down here. And you can see here, would you like to change your password? So you have an option to change that if you feel that you may have been compromised at any point. So to commence starting to enter a VHIMS, so if a patient's fallen or you've hurt yourself at work or there's been a medication error, any one of those things, what we encourage you to do is go down to New, Incident V2. It does take a little while to load, so just one click and it'll load the page. So it brings you to this. This is the new form that we have to complete. It's really important to get that first question right, which is the event relates to patient, worker, relative, visitor or non-person. What you pick here alters the template in which you'll see there that pops up. So it's important to ask yourself, who am I actually reporting about? Who is the first person? What is the name that I'm going to put in that first criteria there? So we'll concentrate on entering a patient report. So what we do is we firstly determine who the patient is. So for example, in this case, we're going to use a patient by the name of Silly Sausage, and his UR number. We'll enter that in there and we'll click it in there. We don't have to enter all those other details, but what we can do is click on Retrieve Details. And if we click on Retrieve Details there, you'll see all his details from previous adverse events that may have been reported will actually appear down here. So you can see what's been going on with this patient over the course of his time or his stays throughout VHS. Once we're happy and then we're satisfied that we've got the correct patient by having a look at his details to confirm it's the correct patient, we just click Accept. And his details will automatically populate into that section, so that section's easily done. When did it occur? So that's where you put the date and the time. If you don't know the time, it's okay to roughly estimate the time. So you just simply pop in a time, and you can just say if the time's been estimated. The notification date, you don't need to change that because that will automatically populate for the day in which you've opened this form. The next section to fill out is where did it occur? So this is about where did the actual incident happen, and the way that we talk about this is, so if it's a medication error and it's, say, pharmacy have dispensed the error, whilst the error may have occurred in the ward errors, the best person to be able to deal with that would be the pharmacy, so we would allocate it back to the pharmacy. However, we'll say this patient has had a fall, and what you would do is pop in your inpatient area. What you select here determines what you'll be able to retrieve further down. So if I click there, you can see that I only get the selections for the ward areas. If I click base hospital, for example, I'll get a whole stack of different areas. So just have a think about where it is that you actually are trying to find and how that actually fits. So we'll say it was an inpatient and the fall has happened on 2 North. The program, you don't have to fill out a program. However, if you're from the allied health world, it's really good to capture that this way. And there's a whole stack of programs in there that you can pick on. So for example, if this was a fall during which physiotherapy were involved, we would scroll down the bottom and find physiotherapy and click on that, and that would enter through there. If you often report, or if you only stay in the one area all the time, what you can actually do over here is click and save your location, and that will remember that, and every time you open up a form, this will actually appear. So you can click on there and save that. If you're on the nursing resource team or nurse bank, we probably wouldn't encourage you to tick that because you do float around the health service. The next section we ask you to do is complete the brief summary. So the brief summary, if you recall, when I click up here on retrieve details, the brief summary is this section here that appears here. So we want to make it as descriptive as we can. So in here, for example, what we would type in would be examples such as found on floor, no head strike. So that way we know what's going on. If we were reporting a pressure injury, it would be something along the lines of pressure injury, stage 1 to the sacrum, acquired in care. So we're really descriptive so that if anybody looks at that, they won't have access to the incident, but they'll know from that descriptor up the top what's exactly happened. Like all of these boxes here, we ask you to de-identify it. So no names, so if we're referring to a patient, we refer to patient. If we're referring to a nurse or a carer, we refer to them by their designation, such as the RN, the EN, the doctor, that sort of stuff. So no names in there. We only put the factual information in there and no judgments in there. So just the facts about what's actually happened. In the detail is where you add as much detail as you can. The more information you add in there, the easier it is for the manager to follow that section up. So you would write things such as patient was found on the floor, he hadn't appeared to strike his head, he was orientated. All of the information that you would normally put in your nursing notes should go in these details. It's not appropriate to write to refer to nursing notes because this information goes to the Department of Health and they don't have access to our notes. So it's really important that we actually have the details in there. And that's the other reason why we don't put in names of people, because it is going to the Department of Health and they don't require that information. So we try and leave that out as best as we can. The immediate actions taken is the next section, and we actually ask you to do things such as write down exactly what's actually happened and what you've done. This will help the manager follow up that incident in the future, and it makes it much easier so that I have to come back and ask you, did you do, have you done? So pop in your immediate actions taken. We encourage words such as you followed the falls protocol, that sort of thing. The words that we don't encourage are words such as all appropriate action taken. The reason we don't encourage that is because all appropriate actions taken means something completely for one person and means something completely different for the next. So we would encourage you to write exactly what it is that you've done. And there's quite a lot of space in there. You can write as much as you like or as much as you need to. Okay. The next section is, was an emergency response called? And if you tick that box, it gives you a few options in there. So this is when we're calling things like our code greys or our code blacks. So you can go and pick one of those if they are applicable to this incident. Once we tick one of those, for example, if it was a code grey, if we ticked there, we would have options there as well. In this case, we'll say that we didn't call an emergency response. Was the next of kin notified? If we tick there, it actually asks you who we contacted, who discussed the incident with them, and the date and time is also in there to be completed. Any section throughout this form that is yellow is mandatory. You won't be able to get out of the form at the end if you haven't completed those details. So if it's yellow, you will have to complete it. The next section, we get to assess how serious we think this incident is and what is the impact and the outcome of this incident. So there are some handy cheat sheets along here. If you click on these little icons as highlighted, if you click on them, up will pop some handy hints. So you can see what those definitions are actually going to mean. So make yourself familiar with them, and as you report more, you will become more familiar with those. So they're on there for all of those boxes, as you can see. So first off, you assess the level of harm. So no harm did not reach person is the first option. And what that would mean is things such as, you've got to put a Bradmar on a label, hasn't affected the patient, has got nowhere near the patient, so it didn't actually reach the patient. The next one, no harm did reach person, might be that the person was walking along, they stumbled, they continued to walk on. So there was a trip there, but it didn't actually harm them. The next one, harm temporary minor, would be they were walking along, they fell down, they got a skin tear, they got back up and then they kept walking. So that would be that one. Harm temporary moderate might mean that they were walking along, they fell down, they fractured their hip and then they ended up coming in. Permanent harm might mean they were walking along, they fell down, they hit their head and they had a subdural and they didn't recover well from that. And death is fairly self-explanatory. So you click the level of harm that is sustained, which is appropriate to your case. The required level of care is the next one that you get to pick. So they are self-explanatory. However, there is a guide, as I said before, no change, current setting, internal transfer for diagnostic testing and monitoring, internal transfer for advanced special care, and external. Keep in mind that internal transfer for us refers to anything within our BHS sites. So if it's a residential person being transferred into the emergency department, for example, that is an internal transfer. External transfer is when we're actually transferring our patients from within here, within our service, to say a metropolitan hospital or to a regional hospital elsewhere. Actions required. So this is no treatment, minor treatment, intermediate treatment and advanced treatment. Advanced treatment means significant medical involvement, and if you click there it actually gives you a bit of a definition as well and a bit of a guide. Once you've selected your selections, it will pop out an incident, what we refer to as an incident severity rating there. So this one's deemed an ISR 3. As you change the treatment orders, for example, if we go to, that would be a moderate. So as you tune that, it will tell you how serious your incident is down here. This section's really important and we really encourage staff to fill it out as best as they can, because as frontline workers, most often you know what needs to happen to improve our service. So we're really looking for you to encourage you to complete this because it's really quite valuable. So we actually ask you, what actions or omissions do you think contributed and what do you think we can do to prevent this? So by completing those boxes, it actually encourages you to actually have different opinions and different considerations as they investigate this incident. Were there any witnesses? If you click on the witness section there, it actually asks you to complete the witness name. Up the top, I did say that we don't put staff names in. However, if there are multiple staff involved, what you can actually do is pop them down here as the witnesses as well, so you can have a record of which staff members were involved. The type of event, if we click over here, it gives us multiple types of events. This changes, so it's different from patient and it's different for a worker, so the fields do change a little bit or slightly. If you click show all is probably the best way, and you can actually work through what it is that you wish to pick. For example, it's full. This one's multi-select, so you can pick as many of these as you wish to pick. Keeping in mind that every time you pick something, it will have a box that you'll have to then complete. So we won't tick any of those, we'll just tick the one. And once you've completed your selection, you click on the tick, which is Save Selection, and then it will populate it automatically into that box. So as I said before, with every selection you get these drop-down tables that they're actually required to be completed. So you just work through those tables and complete them with the details that you have at hand. The green section here is the incident follow-up section. None of that's mandatory for you. This is compulsory for your manager to complete this section here, so you won't be required to complete any of that section. The next section down here is who is reporting. What you do is you pop in your name and your designation. We don't have a lot of selections in there at the moment, however we will be altering that very shortly, so just pick the best fit there. If you want to click on Remember Reported Details, this will remember you every time you log in and will populate that in every time. The incident sign-off, that's actually a section that the clinical risk team will complete when they get your incident, and they'll fill that in, so you're not required to do that as well. The next point we get to is, if this is an incident that you wish to send off to another user that's not your manager, we actually ask you to complete a journal entry, and this will make sure the incident goes to the correct person. To do this, we ask you to add a new journal entry, select a journal type, You might be asking them to do a task, you might be asking them to do a further action, or you just might be doing a general comment. Type in what you want them to do. So for example, if you're just sending this to a manager for your information, you might type, "Hi Jody, FYI, thanks Jody." So in this case, we'll just write in May, because we're just being quick, and we'll just click FYI. To make sure it gets to the right person, we click Select User, and you enter in the user that you want. As you pop in the names, you'll start to see that it starts eliminating users and eventually gets to the right user. Last names are often really easy. If you pop in a last name, you often get to the name that you want a lot quicker. Once you've completed that, you click on Add Entry, and it will go in there. So this hasn't been sent to that person yet and won't be sent until I click Submit down the bottom. Once I click Submit, that journal entry or that comment that I've made will go into the email to a person that it's been allocated to. Before you click Submit, what I need you to do is check on your Change Manager. Make sure that you actually have a manager allocated to your incident. So click on Manager, use your username filter. Again, we'll pop in there, pop in the name, click Enter, find your manager, click Assign, and that person now becomes your manager. If I scroll down there, click Continue, you'll see over here that my manager has now defaulted to Jody Cranham is my manager. I'm going to remove my manager at this stage because I don't want her to get that incident. And all you do next is submit the incident. In the cases of violence and aggression, what we'd actually encourage you to do is complete a worker incident and an aggression incident. So first off, we pop in a patient incident, which reflects the aggression that has occurred. From there, what we ask then staff to do is complete a worker one if they've been exposed to aggression within the incident. To do this, before you click Submit, we ask you to create a linked incident. Once you click on Create Linked Incident, it will pretty much photocopy that incident, and you'll have exactly those details have been brought over. So you can see it takes a little while, just one click and wait, and it will bring across any of those details that I've had. If I had have added in details, lots of details in there, that would have carried that over into this incident. From there, what I would do is click on Worker, and then I would put in my employee details. So it clones that incident. So it makes it a lot easier to report duplicate incidents. This is also the case if somebody had fallen and as a worker, when you're helping them back to bed, you might have had a back strain. So at the same time, you can complete the incident around the fall, and you can also complete the incident around your back strain, for example. Once you've done that, you would just submit the incident. Once you've submitted the incident, this page comes up and it confirms that you have saved that notification. Okay. You can review the incident from this page, or you can go back in and have a look at it, or you can return to your incident page and have a look at it. Once you submit that incident, that will go out. There's lots of alerts in the background. That incident will be sent off to the various people that need to get that, including your line manager. You have the access to go back and look at that incident any time to see where that's been updated, or who's updated it, or who's added to it. And we do send you a confirmation email to say that it's been sent, and how you can continue to follow that incident. This is your front page. At any point, if you wish to go and have a look at your incident, you go to My Workspace, Review My Incident V2, and that will take you to all the incidents that you've ever been sent, have created, or been involved in. So that will take you to a list of that.